There are so many physios and coaches telling you that you need to get a massage or do some random stretches in order to fix your knee pain. They're selling you a quick fix and it never pays off. But in this video, I'm going to give you the exact 7-step system I use with knee pain clients to help them get back to the activity or sport they love doing. This isn't a quick fix, but the system does work. So the first thing we need to address is your limiting beliefs, because if you don't believe in the system, then no matter how much effort you put in, psychologically, you're screwed from the off. You might have been told by people previously that the more pain you experience, the more damage there must be at your knee. And from the research, we know this simply isn't true. This isn't true for two main reasons. The first one is they've done a load of research on MRI scans. They've taken people with no knee pain, they've gone and scanned their knees, and they've actually found a lot of damage at the knee. They've found cartilage wear, they've found bone damage, they found ligament damage. That should tell you that pain is a lot more complex than this, which leads on to point 2, that pain is complex. Why is pain complex? Well, it's because it's incredibly multifactorial, which basically just means it can be affected by a lot of different things. Your beliefs around pain, as we're talking about now. So one of them could be that more pain equals more damage, which is incorrect. Sleep, nutrition, childhood, previous injuries, your mood week to week. By the way, if you want 33 days worth of free injury advice that's going to change the way you think about fixing your knee pain, just check out the top link down below. The most important thing to understand here with rehab is control what you can control, which I'm going to get onto a bit later on, where I'm going to explain the exact exercise system I use with clients to improve your mobility, strength, and confidence. But understand that dips and troughs in rehab are normal because of pain. So you're going to get some weeks where you're not feeling as good. You just have to ride that through and measure your progress in the long term over months and potentially years if you've been dealing with knee pain for a long period of time. The next common limiting belief that you might have is that you need to have surgery. Why have you been told, or why do you think maybe that you need surgery? Well, it's because you think there's something within your knee that inherently needs fixing. Now, this might be true in the case of if you've torn your ACL, you've torn your MCL, you've torn a meniscus, and it's a really serious injury. In those cases, the research does suggest that surgery is a better option. But, this is a big but, if you've been dealing with knee pain for a long period of time, it's due to a lot of other factors. You lack mobility, you lack strength, you lack confidence, you're probably guarding your knee all the time on the injured side, and you avoid loading it. So, very simply, it's weak. And so, surgery isn't really going to fix that. People like to look at surgery and go, oh, this is the quick fix. Even if you have surgery, post-surgery, that's where the work really starts with your rehab. The next limiting belief is that hands-on treatment is the solution. So what do you mean by hands-on treatment? I mean massage, I mean taping, I mean a chiropractor potentially adjusting things around your knee. The reason this doesn't work, and the reason it's as bad as just completely resting, is because as you continue to get hands-on treatment, you go around in this pain cycle, I like to call it, where you get the treatment, then you get some short-term pain relief, STP, STPR. Then you feel good for hours/days. Feels pretty nice. Then you return to the thing that was causing you pain in the first place, sport or activity. Then you get pain again, and then you go back for the treatment. Because the treatment is just the nervous system thing. When you go to get a massage, when you get some tape put on your knee, whatever it is, your brain is sending a signal to that area to give you some pain relief. This is why it feels really nice and why you think it's working. But the reason it's not giving you long-term results is because it's not fixing the things that matter, which I mentioned previously. Mobility, strength, confidence, guarding particular movements. The last main limiting belief is that even exercise-based physio doesn't work. There's a few different reasons people think it doesn't work. Number one, they're just chronically underloaded. They've gone into a physio practice, they've got given 3 exercises on a random bit of paper, and these exercises aren't actually challenging them. They're not loading your muscles, tissues enough, and therefore they're not creating any change. It's a bit like going into the gym and doing something where you're not pushing yourself. You're not going to see any adaptation if you're trying to get a bigger bench press, for example, or a bigger squat. You need to be pushed hard. And obviously there's a difference between pushing hard in rehab and actually experiencing a lot of pain. We want to find the nice balance where you're pushing your muscles and you're training hard and you're experiencing minimal to no pain. That's where the sweet spot is. The second reason a lot of people think physio doesn't work is because they're just inconsistent. So they do their exercises for maybe a few weeks, very sporadically, and they expect a magic fix. The way you want to think about rehab and physio, let's say you've been dealing with knee pain for 6 months and your expectation of knee rehab, knee physio, is that you're going to be fixed in 2 sessions. But if the physio actually explained to you that the things that matter, things we need to improve are your mobility, strength, confidence, and then they explain to you that to actually see significant strength gains, for example, it's going to take 4 weeks at minimum just to see a little improvement in strength, a little improvement in mobility. So if you've been dealing with knee pain for 6 months, and while you've been dealing with knee pain for 6 months, you continue to lose mobility, strength, confidence, then it's not going to be 2 sessions. It's going to be at least 5 or 6 sessions, and it could be the same amount of time that you've been dealing with knee pain for, or longer. So if you've been dealing with knee pain for 5 years, it's not going to be fixed in 2 sessions. The next thing I want to address is lifestyle, because without addressing these 3 key points, the exercise program that I'm going to show you is completely pointless. So the first thing is sleep. You need to be sleeping 7 to 9 hours a night. If you're not doing this, everything else is completely pointless. Sleeping less than 7 hours a night increases your injury risk by up to about 70%. The next thing is nutrition. I'm not a nutritionist, but there's some very simple rules to follow. Number 1, are you a healthy body weight? Are you not a healthy body weight? Very polite way of saying, are you fat? Are you not fat? Do you need to lose a few pounds? Losing a few pounds or a few kilos is going to dramatically affect the amount of pressure and the amount of force going through your knees. It's also going to make it a lot easier to go for walks and do things that you quite like doing with friends or family. And therefore, it has a positive effect in many, many ways. It's going to reduce your knee pain. It's going to get you moving, going to get you stronger, going to get you fitter. You can still do all the exercises without addressing this first. They're just not going to be as effective if you're not a healthy body weight. I'm not saying you have to have a 6-pack. I'm not saying you need to be incredibly lean, but you need to be in fairly good shape. So we're actually going to get into the program now. We need to understand a few key concepts before I actually run through all the exercises. The first key concept, the thing we're trying to achieve with this, is trying to get your knee to bend. In 99% of cases with knee pain, if you've been struggling with knee pain, you know this, you don't want to bend your knee because it's painful. So we want to try bend your knee with less pain. As you work through the phases with the exercises, this is the goal. Initially, even if we're not bending the knee, the idea is to desensitize the area, maybe work the quads a little bit, and then over time, it's a gradual thing. We're not going to go into a really deep squat straight away, but we're just going to go nice and slowly through phase 1, phase 2, phase 3, and phase 4. And as we increase the amount of knee bend, we're also going to increase the amount of load on the knee. So again, phase 1 will start off with a small amount of load, and then by phase 4, you'll be putting more and more force through it. Force through the knee in terms of strength and speed and things like that is not a bad thing, and this is different to just being overweight and walking around with more weight. I'm talking about actually challenging the muscles, the tendons, everything around the knee, which is going to make it stronger and more resilient. Just like with training, if you're learning to do a back squat, you wouldn't go into the rack and put 200 kilos on the barbell. You would start off with just the barbell, work on technique for a little bit, and then you would gradually build up. Exactly the same thing with rehab. So what does the program actually entail? 2 heavier days, heavy, and 1 light day. So the 2 heavy days are predominantly strength focused. The 1 lighter day is a little bit of strength, but mostly mobility. The 2 heavier days are roughly going to take you anywhere from 40 to 60 minutes, depending on how long you rest between exercises. And the lighter day is going to take most people between 15 and 20 minutes. So ideally, you would do the 2 heavy days on Monday and Friday, and then the light day midweek on a Wednesday. And you've got plenty of other time then to rest in between these to recover, and also it's quite flexible with 3 days a week to fit into your routine. With all the exercises, a little bit of pain is okay. If you imagine a scale of 0 to 10, 10 is the worst pain imaginable, 0 is no pain. As long as you stay within that 0 to 3 range, you're absolutely fine. So phase 1, day 1. The first exercise, tibial rotations. You're going to set up with your back against the wall, you're on the floor, and you're going to find the top of your shin bone. So your shin bone, the top of it is just below your kneecap. You're going to find this, and the goal here, as I'm doing, is you want to try rotate your shin bone without your femur, which is the bone above that, between your knee and your hip, without that moving. So we're just getting the knee rotating and getting some blood flow into the area. Try lead with the shin bone. Do this really, really slowly. Try not to let your foot lead the movement. Your foot will flop a little bit side to side because it will happen just as a byproduct of your shin rotating, but just make sure it's not leading. Run through 1 set of 20 reps on each side. From here, we're going to go into a superset. A superset is just 2 exercises back to back with no rest, and then you rest after you've done both exercises. So it's going to be 3 sets of a foam roller bridge and a wall sit. So the foam roller bridge, you're going to hold for 45 seconds. You're going to lie on your back, gentle tuck of your pelvis, so your lower back is flat into the floor. Feet are going to go flat on the foam roller. Lift your hips about 0.5 centimeter off the floor. Your hamstrings and calves should be working really hard in this position. Don't let your heels drop. Hold this position, 45 seconds. Once you've done that, straight into a single leg wall sit. The higher you start up the wall, the easier the exercise is. And if your knee pain is really irritable, it's quite bad, start really high up the wall. I don't care how high you start. The goal is to gradually increase the amount of knee bend by moving down the wall gradually. The next thing we're going to do is try to get the knee bending a little bit more, creating a positive shin angle. So the knee is starting to go nearly over the toes. We're going to use the kickstand hinge to do this. You're going to set up in this staggered stance. You're going to stand on that front leg to get your weight forward, slight knee bend, maintain the knee bend, pop that back leg down for a little bit of support. Then you're going to use a light med ball or a light weight, 1 to 2 kilos out in front of you. You're then going to hinge, so you're going to stick your hips back while keeping your weight forward, and the weight will help you do this. You're then going to sit in that bottom position, just hang in that bottom position over that front hip for 30 seconds for 4 sets on each side. A few things people do wrong here. Number 1 is they don't have their weight far enough forward. If you don't have your weight far enough forward, you'll feel it in your hamstrings. Or if you lose the knee bend, you will feel it in your hamstrings, which we don't want. We want it all in the glutes in this hinge. The next thing is people hinge too far. So they'll get to the bottom and then they'll start to round through their back and they'll feel it in their back. The next exercise is a straight knee calf raise. 3 sets of 5 reps. And I only want you to go from a stretch to a neutral position. So a stretch position is the bottom of a calf raise, and the neutral is not all the way to the top, it's about halfway. Why do we do this? Well, all the research shows, and I've experienced this with clients, you get much better muscle strength and muscle growth from this, because this is actually the hardest part of the calf raise. The top portion isn't particularly difficult. The next exercise is a cable abduction and adduction. So we're working the muscles on the outside of the hip and the inside of the hip. Setup as shown using something for support. Abduction is going to be moving your leg away from your body. So working on the glute medius on the outside of your hip. Then you're going to spin round and do the same leg with adduction. So working on groin muscles. 3 sets of 15 reps on each thing. So 15 reps abduction, 15 reps adduction. Day 2, which is the lighter day. Going to start off again with some tibial rotations, and then you're going to go through that same superset. So the foam roller bridge paired with a single leg wall sit. After that, we're going to do a bit more mobility for the full body. First thing is a spine mobility sequence. Use a PVC pipe or a wooden stick in that back rack position. And then you're going to do these rotations and side bends in all of these different positions. Tall kneeling position to a half kneeling position to a standing position, run through 1 full circuit of that to get everything loose. And then we're going to go into a specific hip mobility exercise, which is a 90-90 knee roll. So you're going to lie on your back. Knees are at 90 degrees. Feet are going to go flat on the wall. They don't move. And then I want you to get the same gentle tuck of your pelvis as we did in the foam roller bridge. So lower back is going to go flat into the floor, and you're going to lift your hips about 1 centimeter off the floor. From this position, I want you to pop your hands on your knees, and it's a very odd sensation. we're going to try shift one side of our hips down towards the floor and then alternate. You want to think of this almost like pushing one bum cheek to the floor and then alternating. Start off really, really slow with this and you'll know when you get the sensation right. Try to make it as much of a up and down movement as possible and not a side to side. Day 3 is the heavy day again. Very, very similar to day 1. The only difference here is once we've done the kickstand hinge, then we're going to do some slightly different accessories. So we're going to do a glute bridge, 3 sets of 8 reps, set up in this position, go heavy on this, overload this with a barbell with a hip thrust pad is the easiest way to do this. Your feet are roughly under your knees, so you've got a 90-degree bend in your knees. If this is too painful, then just decrease the amount of knee bend a little bit. Make sure you tuck your chin slightly, so you've got a nice neutral back. And then you're simply just going to squeeze your glutes from that bottom position all the way up to the top position. The next one is a cable hip flexion exercise. So set up with support, as shown, and then you're going to do 3 sets of 15 reps on each side, as heavy, as challenging as you can. By the way, if you want 33 days worth of free injury advice that's going to change the way you think about fixing your knee pain, just check out the top link down below. Phase 2, day 1. So we're going to start with a tri-set. So again, this is similar to a superset, but instead of 2 exercises, it's going to be 3 exercises back to back before resting. First exercise is going to be a double leg foam roller bridge like you were doing before. Or if this is too easy and you can hold this for 45 seconds with no issues, then you can do the same exercise but on a single leg, which is a lot more challenging. Either 45 seconds on the double leg or between 15 to 30 seconds on the single leg. Then we're going to go into the single leg wall sit again for 45 seconds on each side. And then you're going to go into a pronation exercise, which is encouraging the knee to bend more in a standing position. So you're going to set up in this staggered stance. You're going to very gently go from a straight leg position, so no knee bend, and then you're just going to bend your knee and encourage your knee to go forward a little bit. I don't want you to drive it aggressively over your toes, just to bend a little bit. The key thing here, and the main thing I want you to understand, is when your knee is straight, your shin bone is turned out. So your shin bone is a little bit like a steering wheel. As your knee's straight, this wheel is turned out, so it's externally rotated. And then as you bend your knee, your shin bone internally rotates and you turn the wheel in. And this then translates further down to your foot and the sensation there. As your knee is straight, the weight should be in the heel of your foot. And then as you bend your knee, I want you to feel the sensation more in the middle of your foot and also the inside of your foot. I want you to do that for 10 reps on each side. The next exercise, slouching split squat. Set up in this staggered stance. You're going to tuck your chin slightly, reach out in front of you so your back is nice and relaxed. From here, you're going to very slowly go as deep as you can into this split stance position. The way you do this is not by aggressively driving your knee over your toe, it's simply by breaking at the knee. Go as deep as you can with this, go nice and slowly, don't rush it. Ideally, the gold standard is just to tap your back knee to the floor, and then to stand back up, push really, really hard through the middle of your foot. Run through 3 sets of 8 reps on each side. The next exercise is a kickstand hinge variation again. Same cues, hips back, weight stays forward, and it's just like an RDL. So you're just going to go as deep as you can while maintaining a neutral spine, sit into your hips, get to the bottom position, and then stand back up. As you stand back up, I want you to extend your hips before you extend your knees. All this means is you're using your glutes to stand yourself back up before your knee straightens. You can load this as heavy as you want while maintaining good form. So as long as you're feeling your glutes, keep loading this as nice and heavy. The next exercise is just the straight knee calf raise again. Again, just keep loading this as heavy as you can. Then on day 2, we're going to do the same new tri-set that we did on day 1. We're going to do the foam roller bridge, wall sit pronation. Then you're going to do the spine mobility sequence again, but then you're going to do a new hip shift exercise in a standing position. So you're going to stand on the edge of a plate with a straight leg. And I want you to think about sticking your bum out to the side as you let that leg drop and then hiking it back up as high as you can. Your knee is not bending. All of the movement is coming from the hip. Start off nice and slow and you'll be absolutely fine. 3 sets of 10 reps on each leg. Then we move on to day 3, the last heavy day. The only difference is instead of the kickstand hinge with a barbell, we're just going to introduce some different and new accessories. So we're going to move on to a single leg glute bridge, 3 sets of 8 reps on each side. To make this more challenging, stick a dumbbell, a kettlebell, a weight into your hips. All the same cues apply as the double leg glute bridge. Then we're going to do a little superset for the hips. So we're going to do cable hip flexion again, but for 10 reps on each side. And then you're going to do a cable abduction with a torso lean. Instead of being very, very strict like we were initially, we're going to lean with our torso to increase the stretch further on the outside of the glute. 2 sets of 10 reps, hip flexion, and then 10 reps, cable abduction with a torso lean on both sides. Next, we've got phase 3, which is going to include a bit of jumping and change of direction, which is obviously really important for sport, but also just having strong and resilient knees. So to start with on day 1, we're going to do a nice superset, 2 sets of 10 pronations on each side, and then ideally 30 to 45 seconds on the single leg foam roller bridge on each side. From there, you're going to go into a hinge to exhale drill. Set up a barbell at roughly chest height or a little bit lower. You're going to stand on one leg, get into almost like a single leg RDL position, where you're letting your back leg go as far back as you can, and then you're driving through with a knee bend on the other leg. 3 sets of 4 reps on each side. Then we've got a double leg rotational pogo. Let your upper body and arms get involved, nice and relaxed. 2 sets of 30 seconds. To make this easier, just don't jump aside. To make it more difficult, just jump a little bit higher. Next, we've got karaoke, which looks a bit funny, but it's simply just a crossover with both legs and a crossover with your arms as well. So you're going to do 3 sets of 15 meters. From here, you're going to do a low box lunge, side to side. This scares people a little bit because of the amount of knee bend and the amount of force going through the knee. But to scale it, you simply just don't go as deep with the knee bend. Over time, increase it to build strength and speed qualities at the knee. You're going to do 3 sets of 12 reps here. Then you're going to go into a short split squat, which is the same as a slouching split squat, but you're not going to over-exaggerate that relaxed back position, and you're just going to grab some dumbbells in your hand. 3 sets of 8 reps, all the same cues apply in terms of going as deep as you're comfortable, ideally back leg touching the floor, and then standing back up, pushing hard through the middle of your foot to get your quads working really, really hard. Then we're going to go into a kickstand hinge with a barbell again, exact same exercise, 3 sets of 8 reps, make this challenging. And then the final exercise is just a straight knee calf raise, 3 sets of 5 reps on each side. Continue to overload this and increase the weight to make it more challenging. Then day 2, the lighter day, you're going to do a slightly different tricep. So you're going to do 3 sets of a single leg foam roller bridge, 30 to 45 seconds. Then a single leg wall sit again. So if you've already got to 90 degrees on the single leg wall sit, and this is quite easy, then to make this more challenging, simply just add a weight on your leg. Just take a kettlebell, dumbbell, a plate on there. Then you're going to go into the same pronation drill for 10 reps on each side. Then you're going to do a standing hip shift, 2 sets of 10 reps. And then we're going to introduce a new mobility exercise, a lunge with 3 different reaches. So you're going to do 3 rotations each side. Then you're going to do 3 reaches overhead, looking at behind you. And then you're going to swap legs. And you're going to do this for 3 sets. Day 3 is going to start again with the same superset. 2 rounds, 2 sets of a single leg foam roller bridge, 30 to 45 seconds, paired with a pronation drill for 10 reps. From here, we're going to go into a lateral wall isometric push. So training some speed qualities, but instead of just moving up and down or forward and back, we're now going to move side to side as well. Set up in this position, and you're going to push as hard as you can into the wall. 3 sets of 10 seconds at max effort on each side. Then you're going to go into a lateral hinge to exhale. So very similar to the normal hinge to exhale, but just from a lateral position. So you're going to let that leg come out behind you, bend that knee on the front leg, pop back up into that top position, nice and aggressive. Start off slow to get the technique and then build it from there. 3 sets of 4 reps on each side. From here, we're then going to go into a bound. A lot of people, again, get a little bit scared with this because we're starting to put more force through the knee. So it's very, very normal. But just start off nice and small with these. To make this more challenging, increase the distance you're bounding and increase the amount of knee bend as you land. Go through 3 sets of 6 reps at the max power and the max intent you can. Then we've got a front foot elevated split squat. So you're going to use a plate for your front leg. You're going to go through 3 sets of 8 reps. Make this challenging with some dumbbells in your hand, kettlebells in your hand, or a barbell on your back. And same cues apply here, nice and slow on the way down, as deep as you're comfortable, and then stand back up, push hard through the middle of your foot. And then lastly, we have a lunge isometric, which is a new exercise, set up in this split lunge position, and you're going to do 2 sets of 30 seconds. Make this really challenging by either adding some dumbbells in your hand, kettlebells in your hand, or a barbell in between your legs. Then we've got phase 4, final phase. Day 1, heavy day, starting with the same superset, 2 sets of a single leg foam roller bridge, 30 to 45 seconds into 10 reps of pronation. Then going into a staggered stance pogo. So instead of a double leg pogo, you're going to have 1 foot forward, 1 foot back. And I want you to do 3 sets of 30 seconds. From here, we're going to go into the karaoke again, 3 sets of 15 meters. Then we're going to go into a low box lunge side to side again, 3 sets of 12 reps. Again, to make this more challenging, increase the amount of knee bend. So go into that full depth position. To make it easier, start slightly higher up with less knee bend. Then we're going to go into some low ceiling squat leaps. So you're going to get into the bottom of a squat position. Your heels can come off the floor, absolutely fine. And you're going to do 3 sets of 15 to 20 reps. Then we've got a shrimp squat, which is a new quad exercise. We're going to set up with a slight heel elevation on the front leg, and you're going to set up next to a rig. Grab the rig so you've got some support, so balance isn't a limiting factor. And then you're very simply going to bend that front leg until your back knee touches the ground. And then you're going to push hard, stand back up through the middle of your foot. Overload this with a dumbbell in your hand or a kettlebell in your hand, 3 sets of 8 reps on each side. Then you're going to go into a Romanian deadlift. So this is the same as a lot of the hinge exercises we've been doing, just on 2 legs now instead of 1. Same cues apply. So slight knee bend, your hips are going to go back, your weight is going to stay forward over both legs, and you're just going to go as deep as you can maintain a good hinge without breaking your back position. 3 sets of 8 reps. Make this challenging, obviously, while maintaining good form, so you can feel the sensation mostly in your glutes, a little bit of hamstring, but minimal to no lower back. Then lastly, finishing off with a straight knee calf raise again, 3 sets of 5 reps on each side, only stretch to neutral, and again, just keep trying to add on a little bit of weight to this each week. Then day 2 is exactly the same as phase 3, all the same exercises, tricep, 3 sets of the single leg foam roller bridge, into the single leg wall sit, into the pronation drill, then the standing hip shift, and then the lunge with 3 reaches. Then the final day of the whole thing, day 3, heavy day, starting off again with the same superset. 2 sets of the foam roller bridge, single leg foam roller bridge, 30 to 45 seconds, straight into the pronation drill for 10 reps, into a lateral wall isometric push again, 3 sets of 10 seconds of max power on each side, then a lateral hinge to excel, 3 sets of 4 reps at max power, then a lateral bound, 3 sets of 6 reps at max power, then a lateral bound with an opposite toe touch. Exactly the same, but we're going to increase the difficulty here by having to touch the opposite toe as you get into that landing position. 3 sets of 6 reps and max power and max intent. Then you've got a lateral lunge with a kettlebell reach. Again, looking at training the hip and the groin muscles. You're going to simply step out as far as you're comfortable. And then once you've stepped out, you're going to use that kettlebell or a dumbbell, any weight really, to just encourage a stretch and a reach into that position. Go as far as you're comfortable and as far as you can maintain good form. 3 sets of 8 reps here at a challenging weight on each side. Then into a heel elevated pistol squat. Get a really good amount of heel elevation, so use a plate or a slant board, ideally like this, set up next to a rig. Hand support is ideal, so balance isn't the limiting factor. Then you're going to go as low as you can, ideally into this bottom position, and then stand back up, pushing hard through the middle of your foot, using your quads. 3 sets of 8 to 10 reps. Once you've got this at body weight and it's nice and comfy, then build up and add some weight in your hand to make this more challenging, either the dumbbell or kettlebell. And then finishing off with the lunge isometric again, same thing, 2 sets of 30 seconds on each leg at a challenging weight, dumbbell, kettlebell, or a barbell under your legs. By the way, if you're interested in 33 days of free injury advice that's going to revolutionize the way you think about fixing your knee pain, just check out the top link down below.